Hi, everybody. My name is Reese Fleming. I am a emergency room nurse over at St. Luke's East Hospital.
And I'm Taylor Schoonover. I'm also an ER nurse at St. Luke's on the Plaza ER.
So we're going to be talking about the use of the Ceribell rapid electroencephalogram, otherwise known as an EEG, and how we might be able to use it in the ER. Next slide, please. So our FICO question population is going to be in patients with altered mental status, history of seizures, pseudo seizures, and possibly alcohol withdrawal. Intervention, we're talking about the use of the Ceribell rapid EEG in the ER compared to conventional EEGs that are usually ordered after a patient is admitted. An outcome we're looking at to allow patients to receive quicker and more effective treatment in addition to preventing overtreatment. Next slide, please. So why is this important? So we use EEGs to help kind of determine the patient's brain activity that we might suspect is having some sort of neurological trauma or disorders, and we go about that and we try to treat the underlying neurological condition. So in the ER, we really don't have usually a lot of time to kind of either get a backstory. If somebody comes in via an ambulance, usually little's known prior to why they called for EMS. So we can use the EEG to basically look at the brainwave to see if there is some sort of neurological disorder happening. So whether it be status epilepticus, TBI, traumatic brain injury, stroke, or even the post-cardiac arrest patients, the Ceribell EEG allows for much quicker view at a patient's brain waves than a traditional EEG, and subsequently we can make treatments and interventions a lot quicker. Also, the Ceribell EEG can be seen immediately by the medical team, whether it be neurology, the ER doctors, even the nursing staff, as long as there's Wi-Fi connection. Slide, please. We have a couple different articles that are kind of used to help support the use of this Ceribell EEG. First one was a peer-reviewed research. Purpose of it was to help diagnose and treat patients with suspected non-convulsive status epilepticus, otherwise known as NCSE, in the ER department, and help make timely and effective diagnoses and management. So what the study showed, the method was any patients who were suspected of having a seizure-like activity or NCSE got evaluated by the Ceribell rapid EEG, and we used that to determine what kind of medical intervention we needed. The results of that relatively small sample size was 38 patients in 2 different hospitals that were brought in with suspected NCSE. The Ceribell was able to diagnose one of the patients who actually was suffering from NCSE. 3 patients were confirmed to be having other types of seizure activity and were given anti-seizure medication. The remaining 34 patients actually did not show any signs of seizure activity and were treated accordingly. So this study, in conclusion, showed that the rapid EEG was able to successfully diagnose patients that led to proper treatment and prevention of overtreatment in the majority of patients. So those 34 patients could have possibly gotten anti-seizure treatment when they, in fact, were not actually having seizures. Next slide, please. This other study that we have, Ceribell EEG shortened seizure diagnoses in workforce time, and is useful for COVID isolation, which is becoming more and more popular nowadays. This was a cohort study published in 2021. The purpose of this study was to determine if the Ceribell EEG reduced the amount of time to diagnose and provide effective intervention for acute seizures and altered mental status changes in patients that are in isolation conditions due to respiratory disorders. The method of this, the Ceribell EEG results were actually compared to the standard 18 channel or more channel EEG that was ordered for suspected seizure activity. And then they obviously compared and contrasted the results, and that's obviously led to interventions that were appropriate. So the results of this study actually show that the Ceribell EEG reduced the diagnosis time and the on-call workforce, because these standard EEGs usually have to put an order in, you have to find the EEG technologist, it has to be sent to the neurologist, and just usually takes a lot more time. And this Ceribell EEG can actually be used by the nursing staff or the doctors on the floor if they're properly trained. So the 18-channel EEG, the standard, the range of the time to diagnosis was actually 1 to 5 hours. The Ceribell EEG had a time to diagnoses of less than 1 hour for each patient that was deployed for. The device can be used, like I said, anytime in any kind of floor that they have, as long as the person administering the EEG is trained, and does have advantages in the respiratory isolation rooms because the band can just be left in the room, wiped down. You don't have to worry about cross-contamination with other patients. So conclusion, the Ceribell drastically cut down on the TTD for patients exhibiting seizure-like activity and can be used by nurses and physicians alike, cutting out the need to contact the EEG technologist. The Ceribell can also be quickly disinfected and used in patients' rooms that may be in prone positions, which unfortunately we've been seeing a lot more of with COVID-19 patients. Next slide, please.
We have another article. It compared the rapid EEG, the Ceribell, versus a conventional EEG. The level of evidence, it was a randomized control study, and it just compared the quality of signals recorded with the Ceribell versus the conventional clinical EEG systems. They used methods, the rapid Ceribell applied by a user without prior training in EEG setup, and two conventional, the Nihon, Coden, and Natus. And those studies were applied by a trained EEG tech. The results, 3 recording systems, they had very small differences, but that's just due to the electrodes being placed approximately 2 centimeters apart to prevent any shorting. And the results, that the comparison between all 3, they were equivalent. There wasn't much difference. Conclusion with it, the rapid response EEG quality is equivalent to the conventional EEG systems, and that was observed in a controlled lab environment and in a hospital ICU. Next slide, please. Some recommendations: using the rapid EEG on patients with altered mental status, history of seizures, and alcohol withdrawal in the emergency department prior to admission. And this was used to prevent delaying treatment for seizures or to prevent overtreatment, since physicians often empirically treated for seizures. It's recommended by the American Heart Association as a Class 1 guideline after return of spontaneous circulation, or ROSC, or altered mental status. And Ceribell's partnered with over 200 hospitals in the last year, including the VA, HCA, and University Health System. Next slide, please. If you have any questions, you can email myself at tschoonover@stlukeskc.org or Reese at reefleming1@stluke's.org also. And thank you.